My name is Eman Hassan. I am the Executive Director of the BC Center for Palliative Care, the host of the symposium. And I have been working with the center for 10 years now, almost. And I had the privilege of witnessing the center's incredible growth and journey over 10 years, working hard to advance palliative care in our province and make a difference in people's life. We're not doing this alone. We're doing it with you, in collaboration with all of you. And we just recently, maybe a few weeks ago, we released our latest or second 5-year impact report. So it's or summarize and highlights all the achievements that we were able to do together. And it's remarkable that in just 10 years, the center has become a trusted partner for the health system and the community alike, and a nationally recognized leader in palliative care. It's all because of your trust and willing to collaborate and partner with us. Thank you. We have an exciting day ahead, a program full of top-notch speakers. But before we dive into that, I would like to respectfully and gratefully acknowledge that we are gathering today on the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people. I'm deeply grateful to Elder Carleen and Elder Mar for joining us today and offering their blessings for the event. Elder Carleen and Elder Mar, thank you. Your presence means so much to us. I also recognize the Indigenous peoples across our province and across Canada from coast to coast to coast, and honor the ancestral and traditional lands of the First Nations, Métis, and Inuit people. The symposium, as I said, this is the second symposium, the Altogether Symposium. The first one was in 2021, and we're hoping to host this symposium every 2 years. But this year is a particularly special event for us because the center is celebrating 10 years. It's 10 years, so it's the 10th anniversary. So sorry. Yes, please. It's my phone. I'm really thrilled that we are celebrating the 10th anniversary with you all today. The symposium represents our commitment to you, to showcase your amazing work and innovative ideas as we strive together to integrate palliative care throughout the patient and the family journey in our province. Expect an inspiring and thought-provoking day as we're going to be exploring together effective ways to nurture partnerships between the health system and the community, and we will dive together into new ideas that will definitely shape the future of palliative care in our province. I'll just take 1 minute or so to express my heartfelt gratitude to the Symptom Planning Committee and the BCCPC team who have been working tirelessly for 17 months to bring this event to life. A big thank you also goes to the Abstract Review Committee and the presenters who has worked hard to build the symposium program. And of course, we couldn't do it without our generous sponsors. A huge thank you goes to our platinum sponsor and parent organization, the Institute for Health System Transformation and Sustainability, our silver sponsors and valued provincial partners, Seven Order of St. John's, the BC Hospice Palliative Care Alliance, the BC Hospice Palliative Care Association, and United Way of BC. And our plenary sponsor and long-term pan-Canadian partner, Pallium Canada. Be sure to visit some of the exhibitors' table in the back and explore their valuable resources. I hope you leave the symposium today feeling inspired, energized, and equipped with new ideas, new connections, and new resources. Now, it's my great pleasure to introduce our MC for the day, Dr. Doris Barwick. Dr. Barwick is the founding executive director of the BC Center for Palliative Care. She is a highly respected palliative care physician, educator, researcher, and leader. I'm personally grateful for Doris for her vision in shaping the center's strategic directions during its first 5 years of the center's life. And personally for being a fantastic mentor for me. Thank you, Doris. Before founding the center, Doris co-led Fraser Health Palliative Care Program for over 14 years and has served on numerous provincial and national committees, pioneering innovative palliative care approaches in BC and across Canada. We are thrilled to have you, Doris, with us today to guide our discussion. Thank you.
Good morning. I think, like me, you're happy to be here and to actually see real people and real bodies and be able to engage. It's been a good day so far, and I think it's a real honor for me to be here today and be part of this kind of unique and exciting symposium, which brings together the entire spectrum of the palliative care community. In this room, we have members of the public, patients' family members, volunteers, community organizations, clinicians providing palliative care, policymakers, others who are administrators, and this, as I said, the full spectrum. So we thank you for coming. We thank you for being part of this, and we hope that all of us together will make this the day that it can be. So all together, you'll see that theme comes up over and over again. This will be a forum for us to deeply listen to one another. Sometimes these kinds of opportunities are a chance to listen to people that you would not maybe meet in your normal everyday, but to be challenged and to hear and to engage in dialogue. And it's kind of a rare thing in today's world to have a place where we can listen deeply, where we can honor, cherish, respect others, people's opinion, even if they are not ours, and to hear from them, and then together to dialogue about a better future for our country, for our nations. So as we are all together, and as we are in the spirit of welcome and hospitality, I'm going to ask you now to greet two people you don't know. Introduce yourself, who you represent, and then just at the end of that, say thank you for being here. Thank you for your contributions. So two people, just quickly do that, and then we'll come back together. Thanks, everyone. We're just going to come back to our tables. So in that few minutes, you experienced the possibilities of this day. So welcoming, listening, honoring, cherishing.